we have to think about nerve injuries in a variety of ways. There's a laceration, right, where a nerve is cut in half, and I think the algorithm for treating that's a little bit more straightforward. But I think the challenge comes when you have an injury to a nerve where the nerve is in continuity, such as a blast injury or some type of crushing injury. The challenge here is the surrounding tissue, the scar bed, the zone of injury, and how that's going to impact the recovery of the nerve. You really want to look for the bed that the nerve is going to sit in. And then the thought process should be, well, this nerve has to heal in this environment. What does this environment look like? A lot of muscle injury. If there's other concomitant injuries, like you're doing 2 or 3 flexor tendon injuries right around that nerve, those are hostile environments. So when a nerve is in continuity, but the scar bed around or the zone of injury is going to promote scarring of that nerve, I think that's the time to focus on protecting that nerve. And that is the situation where I will use a nerve protector. I also find that if there's a situation where that nerve is not going to be able to move post-operatively, it's not going to be able to glide, that's another scenario where I have a low threshold to wrap that nerve and protect it so that as the zone of injury continues to recover, the nerve itself doesn't pay additional price. I have had instances where I've reoperated on patients that have had nerve protectors or nerve wraps, and what I've been most impressed with is this almost protective layer that's developed and the gliding that the nerve has. When we think about cost in some of these products, such as nerve protectors, we have to look at not just the cost at the time of surgery, but the cost to the patient. And so if a patient's having a revision carpal tunnel surgery, for example, there's a huge cost to that patient, whether it's out of work, time away from caring for a loved one, time away from activities that they enjoy. So you want to make that cost have value to them. You want them to get the maximum outcome and benefit from your procedure. And so in that scenario, I want to provide all resources available to them to give that nerve an outcome that is worth the time that they took to have the surgery. And so wrapping the nerve or providing some protective barrier around the nerve when the nerve has already been traumatized from surgery 1 and then all of the dissection from surgery 2, I think far outweighs the actual financial cost to the institution.